Some people in our local community mistakenly thought that allergic rhinitis and sinusitis are similar conditions. Hi, I'm Dr. Sow Yih Liang. I'm an otorhinolaryngologist, or commonly known as ear, nose and throat specialist. When we talk about sinus problem, most of the time you are referring to sinus infection, which is also called sinusitis. Sinusitis can be acute or chronic. For acute sinusitis, it is most of the time curable with minimal treatment, while chronic sinusitis could be a little bit challenging to cure. Allergic rhinitis is actually a nasal hypersensitivity condition, which means the nose is oversensitive to certain things, and we call those things as allergens. The examples of allergens are such as pollen, dust mite, mold, or pet dander. When people use the word sinus, most of the time they are referring to paranasal sinus. Para means beside, nasal means the nose, sinus means cavity. Paranasal sinus means that the space around the nose that is filled with air. Sinusitis is present when the lining of the paranasal sinuses becomes swollen or inflamed, and it occurs as the result of an inflammatory reaction or an infection from either virus, bacterial, or fungus. Sinusitis and allergic rhinitis can be mistaken as a similar condition because they share many similar symptoms, especially blocked nose and runny nose. However, there are some key differences between these two conditions. For sinusitis, the nose block is often accompanied by thick, discolored nasal discharge, such as a yellow color or yellow-greenish color, or even foul-smelling nasal discharge. So patients may also feel facial pain between the eyes, forehead, and at the cheek. They may have fever, especially in acute sinusitis. And they may lose their smell or reduce their smell, or sometimes they can smell their own mucus, which is not actually nice. However, allergic rhinitis is a nasal hypersensitivity reaction after exposure to the offending allergens. So the mucus is most of the time watery and transparent. There might be nose block or postnasal drip. One of the key symptoms in allergic rhinitis is sneezing. And people may also suffer from watery eyes, itchy nose. So for allergic rhinitis, patients may suffer from the symptoms intermittently. It could be just for like 10-15 minutes, 30 minutes in the morning, where you have sneezing, runny nose, blocked nose for a while, and you get better after that. As for sinusitis, the symptoms persist as long as the infection is there. So you will continuously suffering for the symptoms from day one until the infection recovers. It could be 1 to 2 weeks in acute condition, and it can be up to months for chronic sinusitis. If the symptoms are mild and not frequent, and it doesn't bother your daily living, then the answer is yes. You just have to avoid allergens. The most common allergen is dust mite. So usually dust mites hide in our blanket, bed sheet, sofa, carpets. So we need to change and clean them frequently. As it is an infection, so most of the time we will prescribe antibiotics to you to treat the infection. We will also give you a nasal spray or oral decongestant. The purpose is to reduce the nose block so that the mucus can flow out easily. We will also prescribe sinus rinse to you to wash the nose, to clear the mucus. We may also prescribe intranasal steroid to patients with sinusitis, especially those with chronic sinusitis. You need to use this medication consistently as told by your doctor. In condition where the sinusitis is so bad that it affects the eye or the brain, we will have to do a surgery as soon as possible. If you find this video helpful to you, please check out on our next video about nasal spray.